Hello and welcome to Fast Track IELTS. My name is Jordan and I'm one of the Fast Track IELTS and OET teachers here. And in today's video, we are going to be talking about the OET writing exam. But more specifically, we're going to be talking about how to structure your OET writing exam letter. And whether you're a doctor, whether you're a nurse, whether you're a vet or any healthcare professional, all of this advice we're going to be given in this video lesson today will still be relevant for you. So the most important thing to know is when it comes to writing your OET written letter, you should really get to know the structure of the letter very well. And ideally, as it says on this page, we should get into the habit of structuring our letter exactly the same way every time that we write it. So for example, paragraph 1, we should be talking about this. Paragraph 2, we should be talking about this. Paragraph 3, we should be talking about this. Even though you're talking about a different patient in the OET letter, even though you're talking about a different condition, different medication, the actual structure of the letter should be exactly the same each and every time you come across these writing tasks. So let's get started then, and let's have a talk about this written structure. Let's have a look in a little bit more detail. So we can see here then it says reviewing structure, and let's have a look through this page and see what it says. So what I would recommend is, if you'd like to know more just generally about the OET writing exam, then feel free to watch some of our other videos. And this video is just going to target how to structure the letter. So, of course, this is a professional, formal letter that we're writing. And we'll know that the first thing we see in the OET case notes is the task. And the task tells us who we are writing to, their profession, their position, and their address as well. And as we can see here on this first page, that's what we're going to include in the introduction. So right at the top of the letter, you're going to include the name of the person you're writing to. So you might be writing to Dr. Smith, you might instead be writing to Nurse Ponsford, for example. Who is it you're writing to? And you'll find that information in the task. Next, as we can see here, you're going to follow that up with their address. And sometimes in the case notes, they will give you two addresses. They'll give you your hospital address and the person you're writing to's address. So make sure you get the recipient's address, meaning the person you're writing to is what's going to go at the top of the letter. And then we're going to follow it up with dear and whoever we're writing to. So dear Dr. Smith, dear Nurse Ponsford, for example. And then for every letter, we're going to write this. We're going to write re, which means regarding. We're going to write the patient's name and then age, and then whatever their age is from the case notes. And again, if you'd like more information about understanding the case notes and more information just generally about what the writing exam is, feel free to watch some of our other OET writing exam videos. So, for example, if we were to look at this introduction, we might have regarding Paul John Smith, aged 55, for example. On another day, it might be re, meaning regarding, Mary Allen, age 22. So the patient's name changes, their age changes, but again, that structure is going to be exactly the same. So now we move on to paragraph 1. And again, all of these paragraphs should have the same information every single letter that we're writing. So in paragraph 1, really there are 4 things we need to do. And there's no true magic sentence that does it, but we want to have a very, very similar structure each time we're doing it. And most importantly, we want to be including all 4 of these things that we can see here. So the first is we need to have the reason we are writing. So is it a transfer letter? Is it a discharge letter? Is it a referral letter? And make sure you're just nice and clear. Don't try and be too subtle here. Make sure you use the word discharge. You use the word transfer. And you very clearly say, this patient's being transferred. This patient's being discharged. We then, of course, in that first paragraph, need to mention the patient's name, the patient that we're caring for. And we've already included their name there, but we probably want to also include it in that first paragraph as well. The other thing we want to include is the main medical issue. That means the main medical problem, why they were admitted to the hospital. Did they have lung disease? Did they have pneumonia? Did they have cancer, diabetes? What was the patient's main medical issue? And then also any relevant dates. And that's usually going to be the date that the patient was admitted into the hospital. So an example paragraph for that first one could be something like, I'm writing regarding Mr. Smith, so the patient's name, who is being transferred from our hospital on this date, so the relevant date, after being diagnosed with pneumonia, let's say. Or I'm writing regarding, Mary Jones, who is being referred to your clinic on this date for further treatment for her diabetes, let's say. There's no kind of magic sentence, as I said before, of exactly how to do this, but we want to have most importantly, we want to get these 4 points. You get the point. Excellent. So let's move forward then. Paragraph 2. And I always think here of paragraph 2 as what happened to the patient, meaning while they were under your care, what happened to them? So did you check their blood pressure levels, for example? Did you monitor their heart rate? When they came in, did they have shortness of breath? I always think of it as what happened to the patient. And there will be some differences here. Generally speaking, for a discharge or a transfer letter, you're just going to talk about the facts. When the patient was admitted to the hospital, he had trouble walking. Then this happened, we did this test, we did this diagnosis with him. What happened to the patient? In a referral letter, however, it may be a little bit different. And in that referral letter, what you might instead have is a list of dates. On the 1st of January, this happened. On the 3rd of January, this happened. On the 10th of January, this happened. And they'll give us all of those dates. And what we want to do instead, only in the referral letter, is to tell that story in paragraph 2 of what happened to the patient. So, for example, when the patient first came in on the 1st of January, he reported shortness of breath. We kept him in overnight, and we did this with him on this date and this on this date. We want to tell that story of the patient and exactly what it is that's happened to them. Perfect. Paragraphs 3 and 4 here then, I always think as just anything else about the patient that is important, anything else that's relevant. So as we can see here, that could be their past medical history, it could be their family history, their lifestyle, their medication, anything else about the patient that is important is going to go in paragraphs 3 and 4. And the reason that that's 2 paragraphs is because we want to separate and split that information apart. Maybe paragraph 3 talks about the past medical history, and maybe paragraph 4 talks about the medication the patient is on. And remember, really think carefully about the difference between paragraph 2 and 3 and 4. Remember, paragraph 2 is what happened to the patient while they were under your care, whereas paragraphs 3 and 4 is what's happened to the patient before. Not this time, this is what's happened before, previous medical problems, let's say. And then very finally, we've got paragraph 5. And paragraph 5, we want to include any jobs, any tasks, anything that we need the person we're writing to do are going to go in that last paragraph. So if we need the recipient of the letter to check the patient's blood pressure or do a follow-up test of some sort or check their medication, anything we need for them to do is going to go right in that last paragraph, paragraph 5. Got it? Yeah? Perfect. And then we want to end our letter with something like, please do not hesitate to contact me if you have any questions. And of course, we're going to sign it off with yours sincerely, and then either end it with nurse or doctor. And in the OET exam, they recommend not including your name. So don't sign your name or put your name at the bottom, just put your profession instead. You won't really lose any marks, but it's something that OET recommend. And it's always good to show the examiners that we understand their requirements. We understand exactly what it is that they're looking for. Excellent. Perfect. So I hope you found this video useful. If you have, feel free to leave a comment in the box below if you've got any questions about the structure of the letter. Our teachers will be more than happy to get back to you and answer any questions that you have. And of course, don't forget to like this video and to subscribe to our channel for more useful OET and IELTS videos. I look forward to seeing you very soon in the next video. Bye bye.